I would like to give the moderation to Zielke, who will moderate that panel. And I'm happy to welcome Tanja Gangarova, Yudit Namer, and Claudia Hövener.
Our healthcare system is unequal. 35.4% of racialized people give up looking for a place in psychotherapy. 64.4% of Black people give up searching for a place in psychotherapy. The chances of developing depressive symptoms is 1.55% higher in people that don't have a sense of belonging, that don't think they belong. 62% of all Black people in psychotherapy feel that their complaints and their experiences are not taken seriously. Our healthcare system is unjust. I analyze, I abstract, I explain, words, 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 more words, concepts, categories, facts, 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 more words. But those that should listen, don't listen. And you know that these numbers don't need to prove that your everyday experiences are real. I cannot think anymore because I have forgotten how I feel. The many simultaneous private and political emotions in my own white body. Silence can mean closing your eyes, like Muriel said earlier today. But silence can also be a space to open up our eyes and listen and witness. I cannot imagine the raw emotions that each of you are faced with every day when you look into the eyes of those who have seen the unimaginable. So thank you a lot for your work and your braveness. The list of unimaginable atrocities that we could be silent for and pay tribute to is perhaps endless, and they each come with more lists of geopolitical facts and images that prove that they are right and that they're all connected, like Maria said. So the emotions that are here in this room, I don't want to instrumentalize them. We shouldn't instrumentalize them to randomly, seemingly randomly, put one cause, one atrocity over another, to say that one kind of suffering matters more than another. But I still want to open up a silent space for you and start off with a minute of silence. So I would like you all, if you can, if you're able to stand up. And find the things that you want to mourn today. Maybe touch your hands, hold the hand of someone close to you. Okay, let's start. You're sitting on a black chair, the floor is wooden. Move your hands, touch something. Maybe get out your phone and send a message to a loved one. Okay, thank you for being there. Now, a bit of a shift back into the talking business. We want to spend the next 80 minutes answering the question, what does solidarity mean to you, to us, in an unequal world? I'm very happy to have a lovely panel here who I'm going to introduce again in a second. So that will be the first third. Then there's some room for discussion. We first will ask each other some questions, reflect, and then give the floor to you, to your comments and questions, and collect them as well, so we can answer them in a bundle. And the third part of our panel discussion today, again, tries to give a bit of room for reflection and paraphrasing and making big abstract concepts that are floating around into something more tangible. Okay, so many heavy emotions here in this room. Like, I was really feeling it earlier, and sometimes hard to make the shift, but yeah, I'm so thankful that Claudia, Tanja, and Yudit are able to join us today and find times in their busy schedules. I will introduce each panelist briefly to cue them in, but we'll leave it up to them to tell you how they contextualize their credentials. Okay, let's start with Tanja. Tanja is a researcher at the National Discrimination and Racism Monitor at the DeZIM Institut. Tanja, what position are you speaking from today, and what does solidarity mean to you?
Hello, everybody. Thank you for the invitation. It's my honor and pleasure to be here and share my vision and my experiences with you. I depart from my own experiences, from my own practices of solidarity as a queer migrant and activist engaged in migrant self-organization, as a public health practitioner, but also as a health researcher as well, as from my basic understanding of solidarity as an embodied set of relations of care. My praxis is very much informed by the work of Angela Davis, who describes solidarity as moving from a place of primary representing ourselves as individuals to a place of conceptualizing ourselves as members of communities of struggle. I'm also very touched and also reminded of the words of the indigenous scholar Lila Watson, who said, "If you have come here to help me, you're wasting your time. But if you have come because your liberation is bound up to mine, then let's work together." Crucially, solidarity is not the instantiation of charity or philanthropy. Being in solidarity with others requires our commitment both to recenter ourselves and to make up collective demands for justice. The work to the center is primary or particularly urgent for white folks like me, who, even with the best intentions, risk co-opting or erasing the suffering of Black, Indigenous, and people of color. So, hence, solidarity involves a lot of work. To be non-racist is not the same of being anti-racist. In order to be anti-racist, we have to recognize and name the historical roots of racism, and that means to acknowledge our own part in the structures that uphold racism. Even if we all think that we are good human beings, we all grow in a racist society, and racism is embedded within us. So the question would be, how do we act in solidarity? By knowing our power and privilege, especially as a white folks. Solidarity involves also taking a risk, being brave enough to take a risk, to risk your life. I have many friends, doctors, who went to Ukraine and Gaza, risking their life, to risk your job or even your institutional funding, risking it for, risking it for justice, for human rights for everybody and everywhere, in Congo, in Sudan, in Ukraine or Gaza. Solidarity involves, if you ask me, okay, how could I translate it into public health or health research, or maybe some would ask why I refuse a framing like refusal as a way of humanizing solidarity, then I have two answers for you. The colonial refusal is more than saying a no. It can be a generative act, one which opens up space for renegotiating the assumption underlying solidarity. Refusal as a concept helps me personally, but helps in general to redirect the attention to power relationships, often overseen into ideas otherwise unacknowledged in solidarity debates or movements, this creating more space for rationality, reciprocity, and care. I will give you one example. As many of you know, the Asylum Seeker Benefit Act, or the Asylbewerberleistungsgesetz, regulate the access to healthcare for asylum seekers in the first months of their asylum seeking procedure in Germany, and limits crystal clear the healthcare to acute care, pain treatment, pregnancy, and vaccination. Despite scientific evidence that this law is discriminatory, the German government decided recently to even extend the time frame from 18 to 36 months, which means that the access to equal healthcare is possible only after 36 months. These restrictions downgrade health from a human right to a citizen right. This is a case of denial of belonging to a group which is considering not fully human. At the same time, various parallel structures were created in order to fix, or better to say, silence the situation created by war. So, if NGOs like Ärzte der Welt, Medibüros, and Medinetze would only deliver treatment to these people without questioning the woe, they would do charity, linking it to Angela Davis. As Professor Michael Mahmoud once said, what good does it do to treat people and not the structure that make them sick? So that could be, if Ärzte der Welt only deliver treatment, that could be a case of reproducing racism through inaction. Instead, Ärzte der Welt and Medibüros refused to offer only treatment. They instead initiated nationwide campaigns targeted German woes, excluding particular population from the health systems, and calling for equal access to treatment and care. I'm glad to see here the committed colleagues from Ärzte der Welt in the audience. For me, this is a form of solidarity by not accepting discriminatory German laws and not following paths expected by white authorities. And the other question is, what does decolonial refusal in health research means in a sense of solidarity? Solidarity in relationship to decolonization is about challenging the very idea of what means to be a human, and by extension, the logic of inclusion and exclusion that enforce social boundaries also in research and through research. I refuse personally to engage in research which pretends to be objective and which is guided by what Bonilla Silva would call white logic and white methods, often creating narratives that paint migrants and refugee communities lazy, crazy, and stupid, or, to use the German terms, hard to reach, or vectors of infections. I try to instead to invest in research methodologies or approaches to research which build on the agency of oppressed communities and aim to achieve social justice by engaging them in the research process and centering their needs, by creating spaces for dialogue and knowledge co-creation, by establishing sufficient resources, and by ongoing challenging the power dynamics within our own research teams, but also our own institution, and by using the data for change. I also refuse to engage in the so-called damage-based research by collecting stories of pain. Professor Nancy Krieger raised the voice by saying we need structural data for structural changes. So by refusing to collect and expose stories of pain, I try to shift the attention to structures which bring racially marginalized communities in the status of being. Why can't we just simply do Rechtsanalyse? Could be enough in many cases. But most important, engaging in discussions on power sharing and data justice in research can be another form of solidarity, because equity is money. Equity is sharing resources, sharing dollars. The question, how to distribute money to communities, so that they can carry out, like EOTO did in Berlin with the Afro census, their own community-driven, community-owned research is crucial in order to prevent that their data can be used against them, as the data are owned and governed by the communities. And this is a crucial question in times of recht extremismus in Europe. So, and I think it's enough for now. Thank you very much.
Thank you very much, Tanja. That was very moving and speaking truth to power. Yudit is professor at the University of Twente at the Faculty of Psychology, Health and Technology, and an old colleague of mine from the University of Bielefeld. And Yudit, what does solidarity mean to you?
So today, I wear many hats, and I will talk probably wearing all the hats at once. I am a psychotherapist. I worked in private practice, but other NGOs as well for more than 15 years now. I have a background of forced migration. I lived in Germany in exile for about 7 years. The exile is now over, but the impact is still there. I'm also a health researcher. Again, worked in very oppressive academic structures of Turkey and Germany, and believe it or not, I found Germany more oppressive than the structures in Turkey. And now I'm trying to navigate all of this in the Netherlands, in a new country for me, so another story of migration. With all of these hats, experiences, beings, I really also kind of respond to what Tanja says, but also what Claudia is going to say. Their points are very, very powerful. But I also think that solidarity doesn't have to, it's a very difficult thing. It doesn't always have to be. There are also smaller, easier ways of doing solidarity, and to me, informality is one of that. What I mean from informality is just, I can also maybe speak with the hat of a psychotherapy client in Germany, because I've also been to psychotherapy for forced migration-related symptoms. Count all of those hats together. And formality in all of these structures, in migration structures, in foreigners' office, at universities, trying to get into psychotherapy, it's very, very suffocating here in Germany. I've lived in other places. I lived in the UK, I lived in the US, I live in Turkey, I live in Israel, I've lived in many places, and I can say that formality here is especially suffocating. And when you are in some kind of psychological pain, it becomes even more suffocating. So for me, informality is one of ways of these deconstructions that we have been talking about today. Informality, I think, is one way of seeing each other's humanity, because formality really kind of kills also, it really dehumanizes as well. What I mean by informality, I will just brainstorm. Also, my talk is very informal today. I just brought some notes written on my contract, because so my contract of today, very informal. One, I think, one way of being let's say, an informal psychotherapist, I think. Of course, there are boundaries. Of course, we have to adhere very, solidly to our boundaries. But I think one way we also see formality in psychotherapy in Germany is the fear of making mistakes. And I mean, I think this is general for, all beginning psychotherapists. It is part of, making a mistake means, can mean also more damaging in a setting of psychotherapy. But making a mistake doesn't have to be, I think most mistakes are reparable, or, the attempt to repair is a very powerful thing. An attempt to repair can really show that you care for the person, and then that act of care can be really healing and very transformative. Then, compared to being a perfect psychotherapist or kind of a, perfect person, because also perfection is very dehumanizing. And this kind of informality, making mistakes, being okay with making mistakes, and trying to repair when you make a mistake, I think it's a good way of informality, and also modeling how it's really okay making a mistake. My experience, so after coming to Germany from Turkey, I saw this very strange personality change in myself. I was a very, not to the point of narcissism, but I was a confident person. And after coming to Germany and, starting working, at a university, that was how, kind of being a researcher, there was such a atmosphere of all of my colleagues being really afraid of making a mistake. It really started affecting me. And also saying, if all these kind of Germans with passports and with citizenship are this afraid of making a mistake, probably the first mistake I make, I'll be out of the door. And probably this isn't a good welcoming space for me. And this kind of formality really shows implicitly, unconsciously gives a message to all the other refugees, all the other forced migrants out there. So just, I think also losing that formality is also a big act of solidarity for, forced migrants, refugees, anyone else who might be really kind of, trying to survive, trying to, make it here. It's also, I'll just, another kind of example could be like when we are enforcing, our psychotherapy boundaries, trying to communicate them, trying to, navigate them, not to be police about it, because there's in psychotherapy sometimes there's a lot of policing of boundaries, what it means if you're late, what it means if you're late with payment, or what it means, you're a little angry today, you're a little aggressive today, you act out today. That's also, I think, time off. Gonna start policing you. Okay, policing. Don't. That's also the policing. Yeah.
Thank you, Yudit.
Because she was pointing to formality, I come today from a decolonizing conference in New Mexico, and what I have learned there is, people told me, because I was the only one from Germany trying to moderate and always looking at my watch, and they told me, we are here at a decolonizing session, and in our culture, we don't own time, air, and earth. So you take as much as you need. Sometimes we should forget about formality.
I'll take that. And again, a mistake that is worth reflecting on, making mistakes, formalizing things that need to be formalized are good ways to remind ourselves. Maybe it was all performative in the end. Okay, thank you, Yudit. Now formally back to Claudia, who was formerly the head of the unit on social determinants in health at the Robert Koch Institute. Really Glad to have you here, Claudia. And what does solidarity mean to you?
Thank you, Julia. Well, let me start to just say a little bit more about myself, where I'm coming from. It's all, you heard it, it's all about the hats we are wearing today, and I'm going to wear multiple hats as well. For one, the head of the RKI representative, but then of course also the head of a researcher, of an activist, of myself, and so on. I will tell you more about this, but important is what we at RKI, what we do is I work at the unit of social determinants, as was said, and we do research on social inequalities. So basically, migration and health, poverty and health, racism and health, discrimination and health, and all its intersections. So, but what's important to me is that it's what we look at is really structural issues. So racism is a structural issue, and not, I mean, it might be individually perceived by people, but of course it is structural. Same, poverty is a structural issue, something that is chosen to be in place by, well, we will come to, government and authorities. But before I worked at the RKI, I was working in health promotion and prevention with underserved populations without health insurance in the US, other marginalized populations, and also as a nurse. So also one-on-one contact is something that's important to me, and I also, as we all do, I have an activist hat. So I was asked by Julia. We wanted to meet up for a Zoom to prepare for the panel, and she asked me, so what does solidarity mean to you? And I was like, wait a minute, I don't think I can respond to this just immediately, because it's very complex with a lot of different takes. But it's also, I noticed that my definition has a lot to do with what hat I'm wearing, who am I, and what position am I reporting to, or am I defining it to. So in my position as at RKI representative, which is, the official hat I'm wearing, I see solidarity as my responsibility to do research that makes the needs of underserved populations and of populations that are not seen more visible. So basically doing research that but we also talked about this. We have a lot of research already on this, that we have inequalities, inequities. However, it is important to continue this, because maybe at some point we will talk to policymakers who will change things. But what I also see as my responsibility, and I'm afraid I haven't succeeded as well, is in terms of solidarity, is to translate the results that we have for people in power. And people in power, or those in power I'm referring to, are politicians, because that is our official role as an institute to consult the government, the federal Ministry of Health, but also other ministries on whatever research we do. So, but informing itself is not necessarily enough, because we do notice that we inform a lot and it's not necessarily being heard. However, I'm trying to give people who are underserved and not being seen a voice to a certain extent, and continuing to describe the disparities that we all know. This includes, of course, different surveys that we conduct, but this also includes involving and including the people we do not see, which it sounds easy, but it's not, because in general at the RKI we do research on representative samples of the general population. So that means basically not necessarily looking at particular groups in need, but trying to advocate for that and trying to get funding for this. It's not easy, and it's something where we sometimes partially succeed and sometimes we don't. But what we also do, and what I'm also trying to change at RKI within the institution, is to create an understanding that we should not just include, but involve people who we are talking about. So what it means is give them a voice, ask them, not just in a quantitative survey, but through participatory research projects, to really having conversations, to trying to understand what is behind the data, behind the results that we are providing. Ask people, hey, can you explain this to me? They will give you good explanations, and they're most of the time more interesting than the discussions that we read in research papers. So basically involving underserved people as equal partners in research, equal partners, really on eye level, and understanding that their experience is just as valid as ours, or more. What it also means, solidarity to me, is constantly reflecting myself and where I'm coming from, reflecting my privileged position as a white woman in, as a manager in an institution, a government institution, and also trying, and that's the hardest, to put myself in the shoes of politicians and different stakeholders, trying to understand what they need to hear, so I can try to give information to them. Well, because and all of you know this, but I want to say it again, we are right now very far away from an equity-based agenda in healthcare that includes everyone who needs it. And what we are aiming for, I think, is a system, and Tanja already referred to this, a system where we do not, well, basically, where everyone has access to the regular system, where we don't need parallel structures to offer support, but where anyone, with whatever needs they have, can get care. Well, I'm sure this is something that we all have in common, but we are not there yet, and hence it is important to have parallel structures, such as the work that you do or other providers do, which is super important. Don't get me wrong, I don't want to say that your work is not important, but in a dream world for me, we would, a lot of the services we have in place right now, we would not need them. But how can I create an understanding for the needs of the underserved? That's the question that I try to ask myself, and how can we translate that to different stakeholders? So I see it as a responsibility to bridge the gap between different stakeholders. So this means trying to get politicians together with practitioners, people from the community, but also people from research, and that works. That's something that works. However, what we see is we have little sparks of motivation and understanding, and after that, nothing really happens. And I think what I see as my responsibility is trying to basically trying to knock on the door as much as possible, so this will happen and finally result in something more sustainable. So constant communication and reminders, I said. Also, while I might try to address the needs of the underserved in a diplomatic way due to my role at RKI, I work together with other stakeholders, and I give results of our research to others so they communicate them and demand and advocate in different words that I can't use as an RKI representative, that you can use. Others can, in this room can use. And this is super important, to work together to try to really push the agenda from different, positions and from different ways. So concluding, this is my last, solidarity for me means utilizing my resources to help others to be seen and working with different stakeholders to make that happen. Ultimately striving, for health, equity, and a world where all people are being heard, seen, and served. So that's.
And thank you, Claudia. It's very powerful to hear a vision from somebody who has power like yourself. Let me give the floor back to you, dear panelists, to respond, challenge each other, if you like.
Maybe I start. I have a question for Yudit. Yudit, it really resonated with me what you said about the fear of making mistakes and fear in general, which is a very predominant emotion in Germany. So do you have good? Well, I really think it's a really important emotion to be addressed, because a lot of the discourse is also based on fear. It's all about fear and losing things. And so how can we change that? How can we address that fear?
It's a difficult question. Thank you, though. I think difficult questions are also very, very important in this context. I would probably, I always, whatever I ask from other people, I try to do it myself. So I try to just, I learned by being vulnerable and being kind of very open about where I am right now, what's happening with me, what is going through my mind, not, of course, overburdening the other person. But just being really open that, this is my humanity showing. And if you want, you can also show your humanity to me. I have encountered this in the German setting a lot as excuse making sometimes. For example, when I shared my, kind of humanity, this is what is going on with me, this is why maybe something like this have happened. I've heard back the response, well, I also have a lot of stuff going on with my life, but I'm not letting this, show in my work. And I, try to then create space for that as well, and not be offended by it, and just, let it sit, not be defensive, giving it back to the other person. As a psychotherapist, as a relational, feminist psychotherapist, I feel that, I only have myself as a tool, and I can, be in a relationship with somebody and giving them the space to do that. But I haven't thought about that structurally. I will do that. Thank you.
I could add something, because I really like the idea about writing about mistakes and my own discomforts by doing research with racialized communities as a white Bulgarian being here. And but also now we are reflecting about our own naivety of trying to implement a very radical research approach, and existing white institutions were far away from it to be ready for that. And we experiences how our research result could be reframed by white peer reviewers, by a founding institution, and so on. And also having the most painful experience by my research participant, by working so much, investing so much emotional labor. That's how they describe the work invested in the project: emotional labor. Sharing experiences of racism is emotional labor. So. And what came at the end, we created the recommendations, and 2 months later the government has changed the law for the worst. Even they made it even worse. And now my participants are coming to me and saying, Tanja, we don't believe in white innocence anymore. We don't believe in white urgency. Don't ask me again to participate in this kind of project. So this disappointment and our accountability and responsibility as a research facilitation, what does it do to us? And this is something which I'm reflecting right now, and I share this mistake or naivety or whatever with you, because I think we all can learn from mistakes. And this is something, if you like the colonial theory, this is very much the colonial thought. No? Yeah.
Yeah, I would like to add to this, because I think that is it's really, in terms of research, it's really unethical that because we motivate people to participate in research, because we say which we believe, because that's why we're doing research. We want to improve the situation. We want to improve conditions. We want to improve healthcare. That's why we're doing research. And so we recruit people and we tell them, please participate, because we need your voice. We need to understand what boundaries there are, what barriers there are, so we can address them. And so then we have the results and we give recommendation and nothing really happens. So this is really, this is extremely difficult and unethical, and it's a discourse that I think is important to have with politicians, but also with funders. And it's also something that we should probably also, as researchers, I don't know how, I mean, it's difficult, but try to have like an implementation period or something, or try to insist on the change of something. And it's not, and that's something that I have to say as well, when I work with the Ministry of Health, people who are working there, they know. I mean, they do know the issues and they want to change it. It's not like they don't want to change it. It's not like people at the ministry are completely blind, but it's difficult if it's not right now popular for the political agenda. And if it's not, then it will not be targeted. Or it might be targeted in the first 2 years after election, but then afterwards it's difficult because it's an election year. So complicated changes are not possible. But it puts us as researchers in a very difficult situation, and it's important to be transparent with that. But it's also a dilemma, because we want to continue research because we still believe something will change, or we hope, and we want to advocate for change. But at the same time, people might not want to join us anymore to do the research. So that's a dilemma that I wanted to say, and it's really important to voice that and to reflect on that, because it's also a burden for everyone doing research, and of course, even bigger burden for people.
Yeah. Thank you all for being so candid. That's not always easy, because you too have things to risk and lose, and it's hard to admit that we are being complicit in a system of white logic. I want to give some space and time to the audience. Questions and comments, please.
From the perspective, I mean, I have many personalities, but from the perspective of community organizing, I think it's also the community have the power to say no to research, to say no to participation, because when participation comes with an invitation, which is always the case by a German institution, it usually comes with conditions, or becomes a condition. So. But communities have power, and we have seen it during COVID-19 pandemic here. Black Lives Matter movements was very strong, even in Germany, and actually that was their work creating so much pressure so that the German government decided to establish the so-called racism monitoring, which is the very first time in the history of Germany taking a decision to collect data on race and racism in Germany. And it came from the communities, and I truly believe in the power of communities, because the change will come from communities. So, yeah, I'm very suspicious when it comes to white innocence. So that's why I really recommend to invest in communities. That's our future. This is my hope.
Yeah, definitely. I completely agree with Tanja, and we have very good examples also from other countries where that works. From the UK, for instance, for different surveys where that really works. Communities asking researchers to do a survey, and they're the bosses, and that's how it should be. But also informality. Informality, I think, is something super important that we can use when we do talk with different stakeholders, because if we create an atmosphere of trust and also openness, also openness to mistakes. It's much easier to understand each other, and I think that's the first way to connect and try to understand. I remember we had a meeting we had a big project called Improving Health Monitoring in Migrant Populations, and we had a final meeting, and we convinced the department head of the ministry, which is a very high level politician actually, to come and be on the podium together with, like, on the panel together with practitioners and all. And I could really tell that he understood and he heard and he listened, and that was important. So because he felt, okay, this is not so much about me being in this position, this is about trying to relate to each other. And in the end, what came out of it was, okay, another research project that got funded. It's a research project again, it's nothing necessarily, but it's also, I think that's the only thing that he knew how to do, but it's, but it was, I noticed that it had an effect. And he said, I need this more often because I don't really understand what the issues are. I don't understand the measures that are suggested or recommended because I can't contextualize them. And so having someone like that there was really good, and trying to just see him as a person and not so much as like, oh my God, there's His Highness is coming over here, which, the president of I was really surprised that this guy came over, but he was just sitting there at an NGO, spending 3 hours with us and had a good time and did understand a little bit more. So also trying to be informal here in these settings is important.
Yeah, exactly. And also the German saying, wir alle kochen mit Wasser. There really is, sometimes there is nothing special about research that all looks so fancy and institutionalized with so much power. But humanizing this and knowing that the people behind the research make mistakes, are very invested in losing face, are fearful, don't want to look stupid or silly themselves when they call other people crazy and stupid and silly, like you've said. That's all a very human experience behind the research that is deeply flawed. Let me try and rephrase. What's your responsibility to frame the information you're putting out, right? So it's not used for harm. And then I would add to that, where are the limits of solidarity? Where is solidarity as something we claim for ourselves, maybe abused as something that sounds good, looks good, but who's there to say that what we say is solidarity is really for the greater good?
I think your thoughts are the most challenging ones, and this is a very difficult questions. Like for me, I, for example, decided not to join the big demonstrations against the AfD. And I will tell you what, because I can't sit beside policymakers who don't even need a Geheimnisplan to openly plan mass deportations. Can you imagine that refugees or people affected by this policy making would join this kind of demonstration? Can you believe they would? They wouldn't. How to expect solidarity when you have policy makers going to this demonstration, washing them innocent, at the same time changing the law so that many who would participate could be deported? This is a very tricky question. So that's why I don't wonder that the very first demonstration here in Berlin was very white. Many migrant organizations refused to participate because they don't see their needs seen and taken seriously. And I think this is something which white folks have to think about.
Yeah, I hear you, Tanja. I completely agree with you. And in regards to what can we practically do, to frame research results in a way that they're not harmful at any. Well, for one, we can try our best, and we really try in terms of there are different publication formats. There's different ways, and also what's really important is the language we use. And that's something that we have paid attention to at RKI in the last years. What language do we use when we talk about people, for instance, about migrants, about people with a history of migration? What language do we use? Migrationshintergrund is probably not a good idea, like migration background. It's not even in English. There's no real word for it. It's a German construct. No, we have to be very concrete, and this is something that I think is important. What language do we use? However, regardless of what language we use, what happens is that some of the information we put out will be taken out of context, and it happens. And I've seen it even by the media. I remember, and this is something, well, I think in 2019 I published an article on the health of children with and without migration status, and I remember DeZIM. You probably, I presented this at conferences to show what happens when you publish something. DeZIM just put online, like, one of the results was that in terms of obesity, that people or children with migration status were more often obese. However, if you looked at their socioeconomic environment, this was not significant anymore. And what did DeZIM do? A lonely big boy at the beach staring at the sea, and said people or children with migration background, a word that I didn't use in this article, are fatter than people without. So this happens, and it happens also. We get a lot of course, one of our responsibilities at RKI is to respond to requests from political parties to questions that they have in terms of and there are a lot of questions by AfD, of course, in terms of migration and health, and we try our best to argue and of course to present the research. However, again, 2 months later we see that the information is taken out of context. So what I want to say is it's important to try our very best to communicate responsibly, communicate in different settings, communicate in different formats. However, we also have to be prepared that information will be taken out of context, and then we have to react. And the press, our department for press releases and all that at RKI does not react, because we are government organization, but there are others that react. So you need ways that someone can help to react to this. Yeah. So I'm afraid we can't completely. Yeah.
I mean, not much I would add to that, but just because I'm also in a different position, I'm not only I do other, I have other roles. I also teach. You also teach. You also teach. But within the position, I don't. If something has been done before, I don't really think that I can do it better, rather than doing another research just because I want to. Not do it because it's there. So I think solidarity with our colleagues who have and communities who have done the research. I think spending our energy and time highlighting their work and advocating for their work rather than using that time to do another research that will show you the same thing is a better use of our resources, because it's there. They've done it. It's brilliant. Rather than doing it, we'll just have to say that they have done it. Yeah. Exactly.
What does solidarity mean in an unequal world? I want to try to briefly paraphrase some of those thoughts that you shared with us today. Thank you. Also, first of all, thank you for being so naked and so brave It's hard, I think, that we're all part of this system that we have mentioned. Each of us in a way that our hands are tied by a white logic. We're being censored by ministries, what kinds of research gets funded, words that are being changed, research that is getting more credibility than other kinds of research. And I like the way that you try to find some ruses, some playfulness to see how can you play with that? How far can we push it to really challenge the system from within? It made me think of Deleuze's idea of a minor literature and coming from a minor language, where Kafka wrote in the language of the oppressed so people could listen to him. And sometimes it's maybe also taking into account some trade-offs, that we are actually being heard, learning the language of the logic that rules the world, but knowing that there is a second world, a parallel world that each of you have also alluded to, that you have because you are carrying those different hats. You have different roles in your public lives and your private lives, and you manage to switch between each of them, where I don't know you find the energy, but somehow you manage to switch and swap and switch and swap. And then where one world, where one island for that moment seems slightly less crazy than the other island. So it's both working within the system and creating parallels, alternatives, different ways of talking about it. Words, numbers, facts, arts, and bodies, and the practices. Well, we have all spoken, all the speaking has been done, and the feeling is continuing, but I'm so glad that we had a chance to be here today. Thank you so much for the invitation. It was a real honor to speak to you, and again, thank you for your courageous work. We've just heard courage, the shared aims, the shared humanness that binds us. Thank you.